My name is Dr. Eric Schnauzer. I am a hip and knee replacement surgeon here at Desert Orthopedic Center. I did my fellowship in joint replacement surgery at the Hospital for Special Surgery in New York City. I did my residency at Case Western Reserve University in Cleveland. Today we're going to talk about hip replacements. A hip replacement is done when the patient has worn out their cartilage in their hip joint. Generally speaking, patients will have severe pain in their groin and buttock area when this occurs. When conservative therapy no longer works, the patient may elect to proceed with a hip replacement surgery. Essentially, the components that comprise a hip replacement are a ball and a socket. The femoral head, which is the patient's native ball, is taken out and replaced with a ball and stem which goes down the femoral canal. The socket portion of the acetabulum, or the cup, is replaced with a metal socket, as we see here. The procedure itself generally lasts about an hour. Following the procedure, we try and get the patient up immediately the same day of surgery. We use a multimodal pain management approach after surgery that generally makes patients very comfortable. It's a combination of what we use for anesthesia as well as what we inject into the patient on the operating room table. Lastly, we control the patient's pain with oral pain medications on the floor. Patients can generally be discharged on post-op day 2 or 3 following a hip replacement. Home health allows the patient to function in their own home, and people are usually more comfortable going home than going to a rehab facility. If their needs dictate such, they will be sent to a rehab facility where they can further recover. However, most patients prefer to go home after a hip replacement. The best therapy following a hip replacement surgery is walking. We want the patients to be mobile. Getting out and moving really helps the patient recover and allows them to get back to their normal day-to-day life. This is the big reason why we did the hip replacement in the first place. With therapy, most patients can usually be off a walker within the first few weeks following a hip replacement surgery. Patients generally will not feel back to normal for a few months after surgery, but by a year's time, they probably won't even remember that they had the surgery. In fact, they will likely be pain-free just as they were before the cartilage in their hip wore out.